Hi, everybody, and welcome to this episode. In honor of May being Mental Health Month, I'd like to talk about 7 important events that have, both good and bad, defined mental health care. Hi, I'm Eric, and welcome to my mental health world. May is Mental Health Month, and so I'd like to spend some time today talking about 7 important events that have, both good and bad, defined the history of mental health care. You know, mental health care has been around for a long time, and there have been good changes and not so good changes and progressive times and interesting developments. There's a lot there. So I'm going to give you what I consider to be my 7 most interesting events, even though there are countless others. So without any delay, here they are. Here's number 1. First, we're going to go way back to the Stone Age, back to a time when our understanding of neurochemistry was essentially non-existent. And like many sciences, astronomy, biology, chemistry, mental illness was thought to be the direct influence or intervention of divine or supernatural forces. Trepanation or trepanning was an early and primitive form of mental health treatment. It was felt that if somebody was acting strangely or differently, or if there's something going on, an evil demon or an evil spirit had taken possession inside the person's head. The prescribed treatment was a little brutal. Rocks and sharp stones were used to bang on the person's skull, bore out a hole in the person's skull to let the demons escape. Sadly, many patients. Number 2. In Greece, around 400 BC, Hippocrates, the father of modern medicine, believed that mental illness was caused by the abundance of 4 different types of bodily fluids, which he called humors. They were blood, black bile, yellow bile, and phlegm. This is actually very important because it was one of the first times where there was an attempt made to link mental illness not with divine forces or supernatural spirits, but rather with something happening inside the body, something chemically or medically happening inside the body. Unfortunately, that train of thought did not last very long. Number 3. So during the Middle Ages, the church became the primary source of treatment for mental illness. Satan was seen as the main cause of mental illness, and so many of the treatments were designed to be specific attacks on him. Exorcism, which included holy incantations, prayer, sprinkling with holy water, bloodletting, and even hurling insults at the person, because it was thought that by hurling insults at the person, you were insulting Satan himself. That became the treatment package of the day. And as time went on, it was thought that some people were not just possessed by Satan, but also in cahoots with Satan, and that they could use special powers given to them by Satan to do his bidding or wreak havoc across the land. Famine, disease, and more were thought to be intentionally caused by these satanic co-conspirators, witches, as they later became known. Death by fire was often the treatment of choice, a practice that was carried over into colonial America. Number 4. Starting in the 18th century, asylums began to emerge as science started to reshape and change how people looked at mental illness. In 1547, in London, for example, the monastery St. Mary of Bethlehem was modified to become a hospital to treat people with mental illness. Later named Bedlam, its practices were far from humane. In fact, they would take, for instance, violent patients and they would put them up on public display for entertainment. As the number of asylums and institutions grew, their reputation for providing poor and even abusive treatment became widespread, and by the late 18th century it was clear that a major overhaul of the system was needed. Philippe Pinel, a physician, restructured and reorganized several hospitals in France to provide a clinically more humanitarian and supportive approach, and with great success, and this was a very radical approach during the time. Over here in America, Benjamin Rush, the father of American psychiatry, had similar success during that same time. Here's number 5. Dr. Sigmund Freud in the early 20th century developed the first model of psychotherapy. He called it psychoanalysis. And even though it was later criticized for being unscientific and way too complicated, psychoanalysis became wildly popular and opened the door to the benefits of counseling and talk therapy. In fact, many of the concepts and images that many people associate with psychiatric care originated with Dr. Freud. Things like analysis of dreams, or concepts like repression and defense mechanisms. Ideas like having the patient lie on the couch and just talk while the therapist sits to the side and takes notes. Or even the idea of the psychiatrist being this older, stoic German doctor with the white beard and the spectacles and the double-breasted suit. These are all ideas that Freud originated and have since become synonymous and even iconic with the idea of psychiatric care. Moving on to number 6. In 1952, a medication that was used for anesthesia called chlorpromazine was found to successfully subdue the symptoms of psychosis. Later, and more commonly known as Thorazine, this was an incredible breakthrough in the treatment of psychiatric illness. Hallucinations, delusions, disorganized thinking could now be successfully ameliorated to the point where those with severe mental illness no longer had to spend months or years or even decades locked away in psychiatric institutions. This discovery paved the way for modern pharmacological treatment of mental illness, from depression to anxiety to schizophrenia to countless others. Number 7. In 1963, President John F. Kennedy signed into law the Community Mental Health Act. The result? Over the next 5 decades, and even up until today, long-term institutions would permanently close their doors and discharge countless numbers of people with severe mental illness back to their home communities to continue treatment. Termed deinstitutionalization, the idea basically had its genesis right after World War II and grew into development through the 1950s. It was based on 2 important concepts. One, that long-term institutions had this horrible reputation for being awful places where the treatment was substandard and even abusive. And 2, the discovery of medications like Thorazine could be used to treat mental illness. Sadly, the whole plan never came together the way it was intended, mostly due to financial or funding disagreements between the states and the feds. And there were other problems too. There were policy disagreements and a whole lot of bureaucracy, and the thing just never really came together the way it was originally intended. The bottom line, prisons and jails have today become the de facto treatment centers for psychiatric illness. But that's a whole different story, and we're going to talk about that very soon. Okay, well, that's it. What I consider to be 7 of the most fascinating and interesting and curious events in the history of mental health care. There are plenty of others, and I encourage you to find time to learn and familiarize yourself with them. If you have any comments or questions or even complaints, you can email me at ericmentalhealth@gmail.com. That's ericmentalhealth@gmail.com. Please, if you have any comments, add them to the comments section below. I'd like to hear from you. And also, subscribe to this channel because we're going to be uploading many more videos in upcoming weeks. May is Mental Health Month, so please help me advocate and support mental health issues and mental health care. Oh, just one more thing. The information provided in this video and all my videos is intended for educational purposes only. It's a resource. It's not intended to be a substitute or an alternative for licensed professional expert advice. If you or someone you know needs mental health help, please, please, please consult a licensed professional, an expert. And as always, if it's an emergency, call 911. Thank you for watching, and thank you for being part of my mental health world. And remember, keep looking up.